Good afternoon. Hi, my name is Ray Santos, and I'm the Chief Development and Community Relations Officer for Ethos. And welcome to another edition of Ethos Live. We've been bringing to you each week some programming from our Healthy Aging program. Last week you saw Ann Glora and Sonia Dahlberg give a great presentation on how to reduce falls in your home. This week we have a really special presentation. We have with us Valerie Frias, our CEO, and she's going to help update you on what's been happening on our end in response to the COVID-19 crisis. So thank you so much, Val, for joining us. Can you just give us a little bit of introduction about who you are, introduce yourself to the audience, because some of our seniors may have not had a chance to meet you yet.
So I'm Valerie Frias. I'm the CEO here. I started in September. It feels like January of last year. I started in September of last year, and have been here for about 8 months at this point. And it was about 6 months into my tenure when the COVID pandemic began here in Massachusetts, and have been really focused on reacting and making sure that we are proactive with our response to that crisis.
So, Val, this is a really tough time for seniors, right? Can you just tell us a little bit about, how hard it is for older adults right now, how this is impacting them?
Sure. So a lot of their social networks are closed. So senior centers, adult day health, parks, places where they would generally congregate with other seniors, with family, are really not allowed anymore. In terms of physical distancing, we are certainly in the city of Boston requiring a physical distance requirement and covering our faces like you and I have masks on right now to make sure that we are limiting spread of COVID. And for elders and for those with underlying physical conditions, that stay-at-home order that the mayor and the governor have put in place is really hitting them hard. They aren't able to get to the grocery stores or out again to see grandchildren who may be asymptomatic carriers. So there's been a lot that has disrupted their social and their family lives disproportionately to others in the community.
Yeah, can you speak to a little bit about some of the places where seniors typically get, hot, nutritious meals?
Sure. So, historically, lots of them grocery shopped for themselves in the city. That was not uncommon. We certainly run the Meals on Wheels program for the city of Boston, and many have received meals through us or at our congregate sites. We had at one point about 35 or 40 sites that we had active where people could meet other elders, have a conversation, have a meal, perhaps a program or an educational or social program. And because of the virus, we had to close those down. They're now food sites, but they're not that social gathering point. And getting to a grocery store when you are really supposed to be staying at home is obviously not possible anymore. So we are really encouraging family members to the extent possible to help elders get groceries if they're able to cook, or bring them meals and leave them at the door. Be safe. So leave them at the door and don't go into the home. But also if there are no other options, or if the senior really needs a prepared meal, please call us. We can certainly help to get a hot delivered meal daily to your home Monday through Friday, with weekend meals given on Friday as well, so that you at least have one hot nutritious meal delivered to you daily.
That's amazing. Social isolation is already a major challenge among older adults, even before the COVID-19 crisis. Can you speak a little bit about how this is compounding that?
So the physical distance that we're all experiencing, again, is disproportionately impacting elders because they're so much more at risk for serious complications and even death from this virus. So it has impacted them in all sorts of ways that we really need as a community to come together to address, because that social isolation should, should not be such that there's no interaction, right? So we need to find ways, like you were talking about earlier with programming, to find new innovative ways using technology, phone calls, check-ins with family members. Bring groceries, bring something that they enjoy, a crossword puzzle, something that they enjoy, and leave it at the door so that there is still some interaction, because physical distance, again, doesn't need to lead to complete social isolation, because that, as you stated so well, is disproportionately impacting older adults, adults who speak different languages and are perhaps not close with their families. So again, this is where Ethos can come in and make sure that someone here or volunteers doing that well check if family can't.
Yeah, no, it's great. I always had the sense that Ethos felt like the surrogate son or daughter for so many older adults who didn't have family or friends close by to help them. Val, can you just for a moment explain to the audience the amazing job that Ethos is doing right now? What resources that we are putting to bear to help seniors through this crisis?
So we really pivoted, like I was saying, in late February, early March. We really pivoted because we wanted to ensure that service delivery was interrupted as little as possible. And again, it may look different, but nearly all of our services are still available to seniors. So that includes the home delivered meals. It includes the congregate sites. Again, they're in a different format, but those sites are available, particularly in large elder buildings. The social programs where elders perhaps used to go to a community center for a class have now pivoted to being online and have been accessed by many elders and are available still. I would encourage you, if you're interested, to look them up on our Facebook page or our YouTube channel. You can watch them multiple times and really take those in when you have some time and want something to do. Our home care team is still doing telephonic visits with all of their clients. Our money management team is working to make sure that we're helping people who need that bill payer service and that assistance. So we are really on all cylinders still engaging, again, with some modified ways of doing business and having those interactions, including using PPE, so personal protective equipment, such as masks and gloves, hand sanitizer. We've trained everyone on good hand washing and hygiene techniques to make sure that if someone is coming to your door with a meal, that they are not going to expose you. They're going to limit the exposure of any virus to you. So we are really doing our best here at Ethos to make sure that all services are delivered in the safest manner possible.
Hopefully, explain to the audience how different the procedure is now, because in a lot of ways, the drivers are going through extraordinary measures to keep seniors safe. And we have this term here that we're using called contactless delivery. Can you just explain to the folks what that means?
Sure. So our drivers have long-standing relationships in many cases with the people to whom they're delivering meals. That used to include a longer conversation, some back and forth dialogue, and we had to change up that model to make sure that we were respecting both the physical distancing requirements, but also limiting any exposure by using masks and not handling food directly to the client. So typically right now, if someone's delivering a meal, they will walk up to the door, front door, or the apartment building if it's in a building. They'll put the food on the doorknob. They'll knock, step back 6 feet at a minimum, more if they can, and ask for acknowledgement from the consumer, from the resident, that they know that the food is there, that they know that the driver is there, and have a bit of a well check. that well check piece is really critical to the Ethos model. And although it's not a face-to-face well check, it still is a way in which we can ask an elder, how are you doing? Do you need anything? Are you feeling okay? Because if the answer is no, that could be the difference between someone getting medical attention that they need or not. So that piece is really, really important, and that's how we are still maintaining that part of the Ethos model that is so important and critical.
That's great. Can you just, we've had to scale up so dramatically over the last several weeks and months. Before this crisis, we were serving around 8,000 meals per day. Tell us a little bit about how much we've grown since then.
So it really is exponential, and every time I look at the numbers or have a phone call with some of our partners, the number and the requests are going up daily. So I looked at the numbers before we started here for this week, and we were at 8,000, and now we're doing about 12,000 meals a day, and that may still go up further in the coming weeks, depending on how long this part of the surge of the pandemic lasts here in Massachusetts. And we're also looking at alternative ways to add food to those who perhaps haven't reached the age of 60 but have a medical need. Other folks that we can help with a second meal if funding is available. So I'm assuming that we're going to get up to about 15,000 meals by mid-May, a day.
That's incredible, and it really goes to show the resiliency of the agency and how we've been able to adapt and make changes on the spot and really understand what the community needs and make changes appropriately for that.
We've been really able to adapt. Our staff has been really great about being flexible and coming up with creative solutions. So it's really a team effort here, and it's really a community effort, and we can't do it, and we can't do it safely without the help of all of you out there. Again, Ray and I are wearing masks, and there is a requirement to wear a face covering in the city of Boston. And even if you yourself, if you're a younger person who's watching this, if you yourself don't feel like you would be susceptible to getting particularly sick, please consider the people we serve, the elders, the disabled, or consider your own family members who may have asthma or some other underlying condition, diabetes. These things are very common, and they impact broad swaths of the community. And so doing your part in again, keeping your face covered, keeping that good physical distance when you're out in public, limiting your outings in public, staying at home when you can, checking in on your relatives or your family friends. Those are all really important things and pretty easy things that you can do to help us to keep people safe.
That's great. So much, we have such amazing partners in the city and the state. Can you tell us a little bit about how they've been able to support us, and how we have a little bit about our working relationship with our partners?
Sure. So the city of Boston, I'll start with, they're a fantastic partner, and we partner with them with the Meals on Wheels program primarily, and they've helped us really to be able, in this emergency time frame, so in this next month or two, to be able to serve more people who perhaps wouldn't be eligible generally for home delivered meals, but for the pandemic. And they've really helped us to find those resources so that we can make sure that if you have a need and you call us, we can serve you. So the city has been great. The state has been a fantastic partner in terms of helping us think through strategically our capacity to increase meals and to have emergency packs if we need emergency packs of meals for consumers. They've been a fantastic partner in terms of that scale, and also in terms of helping us in securing the protective equipment that our drivers and the rest of our staff are utilizing.
Val, I've seen in the office, and I've received calls from so many community members, and they've been making masks for us 24/7. Can you say just a few words about that community effort?
It is a phenomenal community effort. The Southwest Boston area, Boston overall has just been phenomenal. The response has been phenomenal here. We did have a large delivery of homemade masks, both adult and child, so that for staff and for their children, so that when we're out in the community, when we're not here at Ethos, we can keep ourselves and again our families safe, so that we are being part of that solution and not part of a community spread. So there's that. We've had food delivered from people who are appreciative of the work that we're doing. A donation of any size has been fantastic. We've received generous gifts of all sizes from people in the community, and it's really been helpful. But those touches, those homemade masks are just, they warm my heart when I saw them come in yesterday, because there were about 50 of them, and someone worked really hard to get us those masks. So.
It's been amazing, and the creativity that we've seen, it's been just fantastic. And keep them coming. We really do need them, and we want to make sure we can get them out to folks who need them as well. Val, say a little bit more about the state, because there's this Ethos is one of many agencies like ours in the state, and I'm sure that other organizations are challenged just as much as we are. Say a little bit about how the entire network is being adapting to this new environment.
So the senior network, I assume you're talking about, so that we are really collaborating and working together to make sure that we're looking at best practices. This is not a time to have ownership of a particular really good idea. We're out there sharing our good ideas with other partners across the state, so that they too can bring online programming or help us think through, and we help them think through any challenges that perhaps are coming up in any program. So the collegiality and the partnership has been amazing, and that is across the network. So with the Aging Service Point Network, which are a group of 25 organizations across the state that do the same or similar kinds of work that Ethos does. And then our partners at the Executive Office of Elder Affairs, who are really helping us to navigate waters that haven't been navigated in this country in about 100 years.
That's fantastic. I mean, I can't say enough about the entire network, and we learn from each other. We share the things that work really well. They help us find out what doesn't work well, and then they've just been fantastic. Val, can we talk a little bit about home care?
Sure.
A lot of people don't understand what it is and how to access it. Can you just tell us a little bit about it?
Yeah, so home care is a program, and it's unique to every individual. You have a case manager. We could have a case manager here at Ethos who oversees a care plan, and your care plan could include everything from grocery shopping to homemaking, tidying up, could connect you to other services with providers for if you need more personal care needs in the home. So it's a program that's very broad and encompasses things like our home delivered meals. So for example, if your case manager and the nurse who assesses you thinks that you need those meals delivered, that becomes part of your home care. So home care is a very broad umbrella term. It's a great program that we have here. It's available nearly to every senior in some form or another. So if you are in need of services at home in any way, help with taking your trash out, help with tidying up, with food delivery, please call Ethos or call Boston Elder Information at 617-292-6211. Again, that's 617-292-6211, and they will connect you to the organization that covers the part of the city of Boston where you live.
Now, let's talk for a moment about, we're working really hard here at Ethos, and we have these great case managers who are, how have they been able to pivot? Tell our audience a little bit about, where our case managers are today.
So our case managers are, they're working remotely. They are not here on staff, on site, but they are working, and they are connecting with their clients on the same regular basis, but they're doing that telephonically. That is, again, something that the network worked on with the Executive Office of Elder Affairs in these times to make sure that everybody was staying safe, to ensure that services were being delivered, but that unnecessary visits that would put the consumer more at risk were not happening. So if a home visit is absolutely needed from a case manager here, they are going out. But by and large, they're managing that telephonically. And the providers of the more direct services are in fact going in and are, again, wearing that personal protective equipment to make sure that your service delivery is happening in a safe way.
Yeah, some folks that might be viewing, they may not be seniors themselves, they might be stuck at home, maybe they're home from college. What can they do to help Ethos right now?
If you know how to sew, there are some great YouTube videos on how to make masks and face coverings, and again, I can't speak to this enough. When we get gifts of those, they are so appreciated and so useful for staff here and in the community. But drivers, we again are going to see a big and continuing uptick in our home delivered meals program. So if you are home from college and living in Boston and maybe about to finish up your classes, please go on our website and apply to be a home delivered meals driver. That would be a great service. Volunteer to make phone calls to elders. And again, if you can't do it necessarily through Ethos, and do it on your own time and connect with your neighbor, check on your neighbor, give them a call, see if they need some groceries, again, by phone, and then you can drop those at the door in a contactless delivery. And those are some ways in which, again, that you address both an actual physical need, but also address that social isolation that we are trying to avoid.
Last week we would have had our volunteer appreciation event. Obviously we weren't able to have it. Ethos has about 500 volunteers within our core. Can you just speak to a little bit about how volunteers are stepping up right now, and helping us out and bolstering our capacity?
Yes. So volunteers are doing all sorts of things. They're helping with check-ins, with well checks. They're doing grocery shopping for people who are unable to do grocery shopping but have some capacity left. They are doing some driving for us. They are helping us with any online programming that we're doing. I can't get over the masks. I'm going to bring the masks up again. So they're sewing for us. They're delivering personal protective equipment. So we've had deliveries of regular procedure masks and gloves and hand sanitizer and things like that are really hard to come by. But they may be found a little bit of in a store, and they're dropping them off for us, and that's really been very helpful.
Now, folks at home, if they can't volunteer, if they can't make a referral to Ethos, what else can they do? Tell us about some of the other ways that folks can get involved and help their community.
If they can't come to Ethos and get involved in their community, so are we talking about other communities, or are we talking about the elder community?
Well, I think if folks are at home, they can't necessarily come to Ethos to volunteer. They can't necessarily, maybe they don't have enough time to make phone calls for us. What are some of the things that folks can do independently to keep seniors safe in their community?
So again, I would reiterate that if you can't come here. You do have neighbors, and you do have your own family members. So just keeping in touch with them can be really helpful. Assessing whether they need something, especially if you're distant, if you live not close by to your own family, to make sure that they're okay and can connect them with services. And if you don't know where to start, you can always start here, and we can help you figure out that geography.
Now, Val, we're coming close to the end of our conversation today. I want to talk a little bit about what helps drive our organization, and we have great staff, we have amazing volunteers, but there's we obviously need resources to make sure that we can continue our work. And we've recently received a few grants and a few major donations, and hopefully you can just speak to at least one of those large grants, and so folks can understand the impact of those resources.
So we did receive a grant from the city of Boston through their resiliency fund, which was a fund that they established immediately at the beginning of the pandemic to alleviate stress on those hit most hard, those most vulnerable. So those with food insecurity, who are disproportionately impacted based on their skin color, for a variety of reasons, are disproportionately impacted by this virus. And we were fortunate enough to receive one of those grants, and that's how we've been able to scale up to where we are currently with our home delivered meals program. But as I said, we're seeing more and more come in. So, and I don't see this going away in 2 or 3 weeks. The need for that, for those meals, is going to really continue well into 2020 and perhaps into 2021, particularly for the elder community, because they will be those who are on the tail end of restrictions being lifted, right? So elders and those with underlying conditions are going to be told to stay at home perhaps a lot longer than others. So donations to our nutrition program are most welcome at this time.
And I definitely want to make a big plug for support for our community relations team. Typically we have an annual fundraiser called West Roxbury Rocks, and we had some amazing plans for it this year. We had some great names for it, and we had amazing games and activities planned, but unfortunately we weren't able to hold it this year, and we're still hopeful that we might have it a little bit further down the line when it is safer for us to hold that event. But that event raised nearly 40% of the funding for our healthy aging program, the type of programming that comes to you, each week now online through our healthy aging team, and Laura, Sonia Dahlberg, and obviously we're not going to be able to raise those dollars this year. So I want to make a very direct appeal to you all out there. If you want to keep seniors safe, healthy, and active, while they're stuck at home, please visit our website, www.ethocare.org, ethocare.org. Hit the donate button, make a donation that's meaningful to you, and help support the work that we're doing with our healthy aging program. Now, Val, is there anything else that you want to say to the community today? Just anything that we haven't covered about our work, what we're trying to do, and how we're going to move forward during this crisis?
So the first thing I would say as a community is to have a little bit of patience. We all are going to need to be patient in this, in these next few weeks and few months. When the mayor is asking us to take these measures, when the governor is asking us to take these measures, they may seem like a nuisance, but they are saving people's lives. So really to be mindful of that, and to be patient with that, and to abide by the recommendations and the regulations that are out there, is so important. And I know that everybody wants to go outside and the weather's going to be getting nicer, but really in terms of a sense of community and bringing us together as a whole community, these actions are so important to keeping everyone as safe as possible. So I really implore all of you to take them to heart. Please use the mask, the covering, the physical distancing. Stay at home. Use a grocery delivery for yourself if you can, or limit your outings to those essential to your family's safety. But please take these seriously. And again, they may go on a lot longer than any of us like, but they're important. So if nothing else, please take that from this conversation.
This has been fantastic, Val, and I really appreciate you taking the time to really talk to the community. I'm sure that they are all so appreciative of the work that you're doing and the rest of the team is doing. This has been another edition of Ethos Live. We'll bring you another program next week. Look for our emails to let you know what our programming is. If you have any questions, please come to visit our website, www.ethocare.org. If you can spare a little bit of time and volunteer, click on the button and the volunteer button. If you can give a few dollars to help support our work, click on the donate button, and our videos are going to be archived there. And if you want to watch any of the past videos that have been archived, visit our website. We'll see you again next week, and stay strong, stay safe.